Hello, I'm Brad Shattuck, President of Benecom Corporation, Benefit Communication Specialist. Welcome to Open Enrollment. Today, I'm going to go over the voluntary and supplemental insurance benefits that are made available to you on payroll deduction. Before I begin, it's important for you to know that these benefits pay in addition to any other insurance that you may have on your own or with Hillsborough County government. The benefits are paid in the form of direct deposit or in the form of a check directly to your home. In the event of an injury, health event, sickness, cancer, anything, these different policies will provide money for you to make your house payment, car payment, cover deductibles, co-payments, childcare, and many other things. So without any more waiting, let me do a screen share and begin your presentation. Okay, so this year we have a brand new product called Term to 100 Life Insurance, which I will be discussing on the first slide. We continue to offer the supplemental health insurance called SHOP, accident insurance, critical care insurance, cancer, and 29 disease policy. We have a dental supplement and short-term disability. The first program we're going to go over is the brand new plan that you've never been offered. For those of you that are on medications, you have a health condition, this may be one of the few times that you can get on a large policy without any health examinations or health questions while you're working still. So what this is a policy that is term, and the term of time is all the way until age 100. It's brilliant what Allstate's done with this unique policy. In all of our past years, it was permanent whole life or universal life or term insurance, which is term at work, 10, 20, or 30-year term. This doesn't have very much competition. So Term to 100 provides you, regardless of your health and medication, it provides you up to $100,000 of guaranteed life insurance all the way to age 100. There is no health exam or questions. If your spouse is working, you can apply for up to $30,000 without any questions. For a non-working spouse, you can apply for up to $10,000, and for children and grandchildren, the policy lasts for them also until age 100. You can get policies for as little as $4 a kid, and it's $20,000. Now, the policy is guaranteed level premium to age 100. Coverage to age 100. It pays in addition to any other life insurance that you own. The death benefit is guaranteed for the first 5 years on the certificate, after which time it's called and becomes decreasing term life insurance year 6 to year 100 or age 100. So what they've done is Allstate has put an enhancement rider on the policy, and you will see that on the next slide. What that has done is it has designed the features to keep the death benefit level without reducing anything all the way to age 100. So here it is. Allstate Benefits will issue an annual enhancement letter beginning in certificate year 6. The endorsement will indicate that the current death benefit has to be enhanced to an amount equal to the initial death benefit that you were given. So for this example, at $50,000, year 1 through 5 is a guaranteed $50,000. However, the certificate says on year 6, year 7, and year 8, that $50,000 slowly starts to reduce. So on bullet 3, the enhancement plus guarantee kicks in, and those benefits are increased by the amount that they were reduced every single year, maintaining your death benefit the same that it was all the way to age 100. As I said before, it's brilliant. I've never seen an insurance company do this. Now, it includes 2 riders, and these are included in the premium. An accelerated death benefit for terminal illness. If you're diagnosed with a terminal illness with a year or less to live, they will front you 75% up to $100,000 of your life insurance as a living death benefit. Also, it has a disability waiver that's included. Now, should you retire, when you leave, term to 100 is portable. You take it with you out the door. Like I said, this is your policy, stays the same forever. The issue ages, we can go all the way to age 80 at the children's board, smoke or non-smoke, and the grandchildren and children, we can go all the way up to age 25. Now, I'd like to show some rates to save space. I did non-smoking rates. If you are a smoker, please contact my office and we will provide you with the smoker rate. So for an employee, we did get you approved for up to 100,000. I put half of that on here just to give you an idea. 50,000 makes it very affordable. So $7 age 19, age 40, $14, age 50, $29, age 60, $62. So just look at your age, and this is a biweekly premium, and it's good to age 100, no health questions. For spouses, we have working spouses, we have non-working spouses. So for a working spouse, I got you guaranteed up to $30,000. So look at the yellow highlight. You can get policies as little as $4 up to $30, $40, $50, depending on age and what you would like, but no health questions for the spouse if you are dealing with a health situation. Now, if the spouse is, non-working, I got you approved for $10,000 of coverage listed in yellow. If you are younger than 46 years old, the policy does not have a benefit because the state minimum premium requirement doesn't meet the guidelines. So you just go to the next bracket, 20,000 or 30,000 to find your appropriate level of coverage. Children can have $20,000 of coverage up to age 18 or grandchildren, and it is $4 per person. All right, the next program, and we have offered this in the past, is the group accident policy. The accident policy is guaranteed issue, and it is 24 hours of coverage on and off of the job. It pays in addition to workers' comp or any insurance that you have, and all the benefits are paid to you. Now, you'll see it has an accidental death, a traveling benefit for common carriers such as planes and trains, a dismemberment benefit, and then we're going to go to the benefits in bold. So if one of you has a dislocation or a child, a family member, or a fracture, a broken bone, it pays up to $8,000 for you, the county employee, up to $4,000 for your spouses or partners, and up to $2,000 for the children up to age 26. If you become hospitalized from an accident, you will get $2,000 for 24-hour stay for the admission and an $800 paycheck for every day that you're there, beginning with day 1 up to 3 months or 90 days. So one night in the hospital is $2,800. If you're on the modern health plan with the county, there's your deductible. If you're on the traditional, just keep the extra money for the things that you want to use it for. Now, in yellow, down towards the bottom, we have a medical expense benefit. We match the doctor bill dollar for dollar up to $600, and we give it to you. Cuts, burns, bruises, stitches, x-rays, dog bite, bee sting. If you have to go to a doctor because you got hurt in any way, shape, or form, they will match the bill that the insurance company is charged, not what they pay, what they're billed, and they'll give it to you. And that's per accident. Also, at the very bottom, for any doctor's appointment in red, you can get 2 $50 checks or $100 a year for a children's board employee. If you are +1, you can get 4 checks or $200. And this is for any doctor's appointments that you would like in 2022, which includes wellness, ear, eyes, nose, throat, dental, and includes teledoc as well. On page 2, I'm just going to touch on some basics. Cuts pay $200, concussions $600, crutches pay $500. You get 6 visits of physical therapy at $120 a visit. On the other column, follow-up appointments. Say you cut your hand, you have to get the stitches out, or you get an infection. $200 per appointment, 2 per person per accident. You'll also see lodging, transportation, MRIs, CAT scans, medications, surgery, and much, much more. The plan is guaranteed issue. You can keep it for life, and the premiums are on the chart here at the bottom in blue. $6.70, and then it shows the pre-tax savings of $1.51. So this will feel like about $5 less. And then you have employee and spouse or partner, employee and children, no limit on the children, and a family plan. All right, the next program is the GAP plan, the Group Supplemental Health, known as SHOP at the county. If you are confined in the hospital for 24 hours for a health event or an accident or any reason whatsoever other than childbirth, you will get $830 for getting admitted to the hospital. Now, for every day that you are in the hospital, including childbirth, for any reason, you get $330 a day up to 6 months. So for any reason other than childbirth, for one night, you get $1,160 in the hospital. So if you're on the modern plan, that's a nice chunk towards that deductible. If you're on the traditional plan, you're home free for one night. If you go into intensive care, the policy pays an additional $330 a day for up to 6 months in an intensive care unit. COVID, intubation, heart, stroke, cardiac, coronary, burn unit, neonatal care for an infant, and the list goes on. I've also put on here an outpatient emergency room accident benefit. So regardless if you have the accident insurance or not, this policy has an accident benefit of $415 that it will pay you if you go to ER because someone got hurt. Now it will pay 2 times per person per year for using the emergency room. And if you happen to have the accident policy on the previous slide, you will get the accident benefits on top of this accident benefit on the SHOP policy. The next benefit is for outpatient physicians. If you go to any doctor appointment, you get $41 a visit, 5 times a year if you are single, 10 times if you are employee plus 1, 15 if you are family. So that'll give you $205, $410, or $615 back in your pocket for the appointments that you already go for. And this includes teledoc. Surgery is covered in or outpatient. It pays up to $825 per procedure and anesthesia. And at the bottom, all of the benefits on the SHOP plan for county employees increase 5% a year at no additional cost. And in 5 years, you have an extra 25% more coverage. All right, now for the Children's Board. If you were hired on November 1st of 2020 or after, we can do this guaranteed issue for you with no health questions. If you have a health condition right now, your health condition would be covered in 12 months. Anything new is covered on January 1. If you were hired after November 1st, you are an existing employee, then there are health questions on this plan. The policy has age brackets. Please look at the age that you will be on January 1, and that is the premium and the rate that we can lock you in forever. So for example, I am 50 to 59. It says 2152. And then I'm going to save $4.84 in the county's cafeteria plan. This will feel like about $16 per pay period. All right, our next program is the critical illness plan that pays county employees $15,000 should you have a heart attack, stroke, renal failure, need a kidney, heart, liver, lung, or a pancreas for a transplant, or should you have an artery bypass, it pays $3,750. Your dependents get 50% of the government employee's benefit, and it does have a benefit that pays if the event does happen a second time, it will pay again. This includes benefits for Alzheimer's and Parkinson's. a benign non-cancerous brain tumor, coma, loss of hearing, blindness, and paralysis. And everybody in the family gets a $100 benefit check for a wellness test listed. I have it highlighted here in yellow. You will see there is cholesterol, there is an HPV vaccination for children, there is male exams, there is a chest x-ray, EKG, stress test on a bicycle or a treadmill. So that's one check of $100 per person per year. Now, this is why it's important that you got that point, because most of you can get this policy for little or no cost. This is one of those government benefits that a lot of the public is not privy to. So here's how it works. If you are on the grid here, employee or employee and children, children are free. Employee and spouse, employee and family, children are free. So 51 to 54 is my age, and a lot of you know I have 3 daughters. So for $8.68, and I can save $1.95, I can insure myself and all 3 of my daughters. So that's $180 a year approximately. But look at the bottom. Remember, we get $100 per person for one of the wellness physicals. That's $400 that we're going to provide you. And that insurance for my age is only $180 a year with the cafeteria discount. So do your math. This is a huge benefit for very little or no cost at all. The next benefit is the cancer insurance with these 29 diseases. The program covers skin cancer, internal cancer, autoimmune diseases such as lupus and MS, hepatitis B, C, sickle cell anemia, and many others. This policy for the Children's Board is guaranteed issue if you were hired 11/1 of 2020 or after. If you were hired before that date, you are a veteran employee, then there will be one health question. If you do have one of these illnesses or diseases and you were hired on 11/1 of 2020 or after, you can be given the policy and your pre-existing condition will be covered in 12 months. The benefits. I like to start right here on page 2 with what's called the initial diagnosis benefit of $5,000. So should you or a family member be diagnosed with internal cancer or one of those 29 diseases, the very first thing that we will do is send you a check for $5,000 so you can shut down from work, get a game plan, maybe pay your rent, your mortgage, get the bills get caught up. Just be prepared. The next benefit is at the top for the hospital. So if and when you go to the hospital, your paycheck is $200 a day, every single day, even for the rest of your life if necessary. There is no $1 million limit on the plan. That's $1,400 a week if you are hospitalized. Now, should you go to the VA hospital if you are a military veteran or family member, or a St. Jude's type charity hospital, it will pay an additional benefit of $200 a day. You will see home care, hospice, home health care teams. We also match the doctor bill every 12 months for your chemotherapy and radiation treatment, up to $10,000, and we give it to you. We do the same for blood plasma and platelets, and then it resets on January 1. Surgery is covered on the cancer and catastrophic plan, in and outpatient, and it covers anesthesia as well. $200 for a second opinion, and the policy has benefits for family transportation and lodging to keep your family together when family's needed most. You will also see a $5,000 benefit for experimental treatment, and this includes COVID in yellow. We have an intensive care additional benefit. It has nothing to do with cancer, the 29 diseases, or anything. It's just basically if you or anyone on the policy is put into ICU for any reason at all, including COVID, you get $200 a day for a month and a half or 45 days on the cancer and catastrophic policy. It's a wonderful caveat. Now, lastly, this plan has a bone marrow screening or a cancer screening benefit. It is the wellness benefit. and it pays $100 per person per year for any one of these examinations listed. If you have multiple policies and you have a physical, then you will get multiple checks for one physical examination. So premiums are below $11. You save $249. It'll feel like about $19 for family or single parent or husband and wife, and then you'll save $4 with pre-tax. It'll feel like about $15. There's a website for your claims that's secureallstatebenefits.com/mybenefits. We also have a few AFLAC supplement policies, which include the dental supplement. The dental supplement supercharges your dental insurance and provides you with a total freedom dental plan. There's no copay or deductible, and it pays regardless of any other dental insurance. The maximum amount of money that the dental insurance supplement pays is $1,680 a year, and then it resets. When it resets, AFLAC adds $120 a year to your maximum, and in 5 years, you will have gained or accrued an additional $600 of benefits at no additional charge. So here's how the program works. You can go right away January 1, 2022 and have your prevention done, your bite wing x-ray, your cleaning, and it will pay you $35 for your checkup and $20 for your x-ray. So that's every 6 months, and that's per person in the family. If you have a filling or cavity, it pays up to $310 for gold, $70 to $75 for the white resin composite fillings. Silver, no one's doing it anymore because of mercury. Preventative, children for space maintainers and sealants. Oral surgery covers tooth extractions such as abscess teeth, wisdom teeth, impacted teeth, getting adult or youth mouths ready for braces and pulling teeth. Now, the plan does not cover braces, but it does cover pulling teeth in preparation for braces. Gums, periodontal disease and deep conditioning, and prosthetic repair. Add a tooth, add a class, rebase, condition your gums, and this pays up to $1,040 after 6 months. Crowns, we cover titanium and high noble metal on the AFLAC dental supplement, which is rare, including ceramic, porcelain, and metallic. After you've had the plan for 24 months, major prosthetics are covered, which are implants, dentures, and partials. And there is one catch. If you have a tooth missing right now before January 1, 2022, it is not covered for an implant or bridge. It's pre-existing. If you lose a tooth after January 1, it's covered on the plan for replacement. Premiums are at the bottom in bold with the pre-tax savings next to it for single, employee and children, employee and spouse or partner, and family coverage. We're almost finished. We also have a short-term disability offering from AFLAC. Short-term disability protects your income should you be out of work for sick or injury. This plan pays you for half of a year, 6 months. It covers you for off-the-job accidents. It begins on 0 the first day if you get hurt off of the job. And it begins on the 8th day for sickness, health, COVID, including maternity. My examples in yellow, if you are age 18 to 49 for $13.20 a pay period, you can get a $1,000 disability insurance policy. If you're 50 to 64, $14.40 and $18, 65 to age 74. This pays in addition to any disability insurance that you may have to protect your income further. How do I enroll? Well, due to the pandemic, Benecom has received approval to take your applications over the phone or even by email to help you and save time. So the emails are listed for myself and my daughter, Amber. You've got Brad at benecom.com, Amber at mybenecom.com. You have my cell phone number for phone questions and to sign up. You have Amber's work phone number and our HIPAA secure fax. And we also have a secure website for you to view this video and obtain the brochures and forms. It's secure at www.benecom.com/Hillsborough and just click on Children's Board of Hillsborough County. We're also available on any device 24 hours a day, and I will stop screen sharing. Thank you for paying attention. I know that was long, but we only get once a year to go over all of this. I hope it was thorough. I'm here to help you at all times, day or night and weekends. Take care, and thank you very much.